I understand you also huddle with residents. Can you talk a little bit about why it's important to meet with residents every day in a huddle?
Yes, we, being an educational institution, we believe that it is extremely important to include the residents in the huddle process. Huddling is something that I think physicians have always done. However, to do it in a more formal setting allows the resident to understand all the components of the huddle and the importance of the huddle, as well as it being an educational piece. So we have two different types of huddles here. We have our general clinic huddle, and our general clinic is where there are a number of providers sharing the same schedule. So when the resident participates in that huddle becomes very important to the residents as they prepare for that huddle to learn how to cross-cover on patients who may not belong to them. How do you review the chart ahead of time to get a quick idea of the patient that's coming into your clinic that day, so that you can best, one, communicate that information to your staff, communicate that information to your ancillary staff as well as to other providers. So that allows the resident to understand chart review, quick chart review, and to pick out those things that are pertinent for the day for that patient.
Do they also welcome the huddle? Does the resident enjoy doing that?
Yes, they do, and they primarily focus on the continuity clinics of other residents, but they will also participate and prepare huddle for the general clinic. And so we give them different tasks on different days so that they can get a little bit of kind of working in a general setting, a general clinic, but then also kind of working in a partnership, which is what they will do with their continuity clinics, even if they're not in continuity clinic that day. But it also helps them to learn how to cover for their partners. The other type of huddle that the resident will participate in is for their own continuity clinic, and this is called a mini huddle. This huddle is not done with the entire staff of the clinic. This is done just with the resident and the preceptor right before the resident's clinic. And these clinics are very brief and very short, and they focus on the resident's patients only. And what this particular huddle is very important for is primarily for education, to teach the resident exactly how to pick out pertinent information, help them see things that maybe they wouldn't have seen, or anticipate things that maybe they wouldn't have anticipated before their clinic starts. So it kind of teaches the resident to get in the mindset of always reviewing your schedule for the day, kind of having an idea of what you may need, communicating that to your staff, as well as you, the resident themselves, preparing for what they may need to do that day with that patient. It also teaches the resident about organization and how to keep themselves more organized before, during, and after the visit. It helps them to anticipate things so that they can get the most accomplished for that patient in that visit on that same day. For those residents who are independent, this also helps the preceptor and the resident anticipate and communicate issues or needs of the patient before the resident goes and sees the patient. In our clinic setting, our senior residents are allowed to see the patients independently and staff at the end of the day. Those patients may or may not be still in the clinic at the time of staffing. So by pre-huddling, by doing this mini huddle before their clinic starts, we can anticipate those things that are most likely needed, or I, as the preceptor, can communicate to the resident, hey, I want to see that patient today. Please don't let the patient leave because I want to see the patient. Or the resident can communicate to me, hey, Dr. Stewart, I would like for you to see this patient today, even though I know it's just a routine well child check, but I want you to check in with the parents. So something like that, that can be communicated as well, so that things are not missed.